Hi, I'm Dr. Sutter. I'm here today to support you in making any decisions about how you might want to take care of the arthritis if you have joint pain. And what we do is we feed the joint with products that lubricate the joint, decrease the swelling, and also will help you increase your strength. It's well-studied products, a group of products have been studied for over 30 years. More recent is about 15 years ago. Let's draw the joint so you get a basic lay of the land and how this stuff works. So all joints are built like this. This is the bone, and then the cartilage is the slippery surface that allows the joint to move effortlessly. Now we know that the cartilage, when it's on top of other cartilage, it's about as slippery as ice on ice, but 10 times more slippery. That's very slippery. This is an important part of mobility. We also know that the bone stops with the blood vessels and all the blood supply. So the only way this cartilage can get any support directly is through the lining of the joint. The lining of the joint is like a super filter. So it's very richly vascularized, and it produces stuff that makes this cartilage not only more slippery, but also nourishes it. So it drives this substance called hyaluronic acid and some chondroitin sulfate into the cartilage. The interesting thing is you need to move to do that. So is rest a good idea for arthritis? No. Is too much exercise a good idea for arthritis? No. We also know for many, many years that these individual little cells respond very well to glucosamine sulfate, chondroitin sulfate, MSM, and SAMe. Now, these have been very well studied over many years. SAMe is expensive. Most people don't need it. Unless you're really dying in the morning, you wouldn't use SAMe. This group of products, glucosamine, chondroitin, and MSM, have been around. If you've had an older dog and you saw how it works with the dog, you'll know that it does work. And it does work for humans. They try to disprove that. They did one big study that cost about $12.5 million, and it came out with equivocal results. Then Eric Hockman, the chief of rheumatology up at University of Maryland, restudied this with a multi-center study and showed what everybody knew was to be correct, that it did work. So this is about 4 capsules a day, which kind of is a lot of pills for most people. And the hyaluronic acid is 2 caps a day. Now, we know this is called Mobilee, M-O-B-I-L-E-E, and that's what we use in our product called HA+. There's also some hesperidin and hops derivatives. Both have been shown in studies to help nurture this lining of the joint. Okay, this is super, super important. And when you see a swollen, boggy joint, that's what's swollen and boggy, is this lining all the way around the joint. So it's pretty clear to see that the HA is even though it's a new kid on the block, it does help. It was a good study with humans, over 200 patients, and they fed them this for 3 months. They found that at about 8 weeks, they started to respond with decreased swelling, decreased pain, and increased strength. There was an elegant study done in Barcelona. I actually visited the scientists who did this. They originally started the studies way back after, right after the millennium, with horses. Now there's a lot of very expensive horses in Spain, and they studied it with a very difficult condition called an osteochondral defect, where they have kind of a hole in the cartilage, and it really did help with that. The veterinarians then talked to their human research colleagues, then decided to study it in humans, which of course takes a couple years, and this is what it turned out to be. So happy hunting on your supplements that helps you for your joints and your arthritis, and stay tuned. We'll have some more coming soon.